Hypoxic ischemic encephalopathy. When the child, when the newborn, fail to establish respiration immediately after birth, we call it asphyxia. When it is severe sort of asphyxia, there is hypoxic injury to the brain and other organs. We call it hypoxic ischemic encephalopathy and hypoxic ischemic other organ dysfunction. So there is high amount of mortality in severe cases of the hypoxic ischemic encephalopathy, HIE, and up to 50% of the child loss, neonatal loss, has been described. So because of the hypoxia, these children has brain infarction and at times hemorrhage and thereby developmental disorders in the long term. 6% of the cerebral palsy has been contributed by the hypoxic ischemic encephalopathy. More often, you have these sort of things when there is acidosis and your base deficit more than 25 millimole per liter. And that can be multi-organ dysfunctions like cardiac, the heart death, heart may systole, may stop in a systole, and then the renal failure, acute tubular necrosis, acute cortical necrosis, both are common, thereby acute kidney injury, and subsequently in the long term chronic kidney disease (CKD). And then GIT perforation and the ulceration hemorrhage all are possible. DSC, like in severe sort of hypoxic insult, you have this sort of thing, SEAT, hypocalcemia, and hypoglycemia, hyponatremia. This sort of dyslipidemia is quite possible in the severe sort of hypoxic insult in the newborn period. And skin appearance, subcutaneous fat necrosis is quite common in severe sort of insult. So thereby safe delivery of the newborn, no asphyxia sort of behavior, and then the child who has CPD, cephalopelvic disproportion, should have cesarean section, skilled hand and skilled place. No human error should take place in the birth process.